So good day everyone. My name is Onowari Victor. I am a neurology applicant and I will be doing the Gen comprehensive review in clinical neurology. We've done questions 1 to 29 and now we are about to do 30 to 31. So our question goes thus. A 64-year-old man presents with right homonymous hemianopia. Which of the following is the most likely localization for this finding? So we have A, the left upper lip of the calcarean cortex, B, the right optic tract, C, the left parietal lobe, D, the left lateral geniculate body, and E, the temporal lobe in fact. Now let us just do a very brief run through on the optic nerve and its track, the optic pathway. And when we do that, we're going to answer this interesting question. So let's begin. Um, Over here we have the optic or the visual pathway. At the optic housing, the retinal ganglion afferent from the temporal retina, which carries the nasal visual field, continues in the ipsilateral optic housing and passes on to the ipsilateral optic tract. Whereas the retinal ganglion afferent from the nasal retina on the temporal field deposits in the optic chiasm and continues to the contralateral optic tract. So therefore, beyond the optic chiasm, each optic tract contains cross fibers and uncrossed fibers that release visual information from the contralateral visual field. Now, the optic tract continues to the lateral geniculate body, and beyond the LGB, the optic tract continues to carry visual information from the contralateral visual field to the primary visual cortex in the occipital lobe. Now, it gives us something we call the optic radiations, and the superior fibers carry information from the inferior visual field as they pass through the parietal lobe, whereas the inferior fibers carry information from the superior visual field and they pass through the temporal lobe. And this gives a loop which we call the Meyer's loop. Now, when this visual information reaches the visual cortex, it gets into the calcarean cortex, which has an upper bank and a lower bank. The upper bank carries information from the inferior visual field, whereas the lower bank carries information that contains um, the superior visual field. So, what we should know is that if you have a retrochiasmal lesion, that is a lesion at the back of the chiasm, we are going to get some sort of homonymous hemianopia. Chondrotanopsia will be caused by affectation of the calcarean cortex, depending on where it's affected. So either the upper or the lower calcarean cortex, or the right or the left calcarean cortex, which carries information from their contralateral visual field. So back to our question. So for question 30, we've established that the answer is going to be the left lateral geniculate body. So for question 31, a 57-year-old woman presents with the left upper chondrotanopsia. Which of the following will be the likely localization? So we've already said that when you have chondrotanopsia, it's going to be something related to the calcarean cortex. So the left upper visual field is affected, and that means that we'll have an issue with the lower back of the calcarean cortex, and it's actually on the left upper, so it will be in the right lower bank of the calcarean cortex. That's options A. So that's it for that. Let's see you in the next session.